All right, so hi everyone. And I wanted to welcome everyone to our CAP presentation. And our group chose to focus on a community wellness project. With, of course, we had some bumps in the road, some ups, some downs, but it was great. Before we talk about our project, I'm going to introduce everyone that's in our group. While I'm introducing everyone, I will share each of our top 5 strengths. This is based on the Clifton Strength Finder themes of talent. So our first member is Colleen. Colleen's top 5 are empathy, adaptability, communication, woo, and positivity. Doyin is next in line, and her top 5 is responsibility, deliberative, significance, relator, and empathy. Next is Jo with harmony, responsibility, consistency, adaptability, and relator in her top 5. Julie is a learner, restorative, harmony, input, and intellection. And lastly, myself. My top 5 are responsibility, analytical, harmony, consistency, and learner. So before we started to work as a group, we got together in our retreat back in September to kind of brainstorm the types of projects we all wanted to work on. Our group came together and wanted to work on a project that surrounded the idea of community and well-being. And our goal here was to promote, increase, improve overall well-being within Wood Buffalo. This, of course, also ties back to the UN Sustainable Development Goal for health and well-being, which is to ensure healthy lives and promote well-being for all at all ages. When we decided that we wanted to work on community wellness, we knew we had to have a focus group, a demographic to focus on. And this was maybe one of the easier ideas or easiest decisions that we had made as a group, because it was clear from the start that we had 2 groups that we were very passionate about. So while discussing in the larger group, this is what we kind of found. And then when we came together to work on community wellness, we first really discussed prenatal and birth options for women, as well as postpartum supports and help or options in our community. And the other area we couldn't stop discussing was the need for better support for isolated seniors in our region. So, of course, working in community and not being experts in these areas, before we did anything, before we decided on a focus, we wanted to meet with the experts and the people working in these areas. So when we're looking at seniors, we wanted to make sure that we contacted agencies such as the Golden Year Society and St. Aidan's. And then when we were looking at this children and prenatal, postnatal care, we wanted to get in contact with the YMCA, Wood Buffalo Women and Baby Care Society, the Hub, and the Boys and Girls Club. So when we were looking at the young population, so young parents, parents of new children, pregnant, expecting parents, we wanted to further investigate what pregnancy, birth, and early childhood look like in our community. On average, our region sees 1,300 births a year. That equals out to about 108 per month. And as of 2019, the only options for women in our region for prenatal care, childbirth, and postpartum care was within the traditional medical system, within the hospital, and having an OB care for that woman. So this glaringly showed us that there is lack of options to women in our community, and we really wanted to get in contact with the Wood Buffalo Women and Baby Care Association, who have been advocating for midwifery and a birth center in our region for a number of years. Just to note, as of February 2020, Wood Buffalo has had 1 midwife added to our medical team, and then since then we have 1 more. So in Wood Buffalo right now we have 2 midwives, so they're definitely on their way. And so when we met with the Wood Buffalo women and baby care, their main focuses was to get fund development and support with that, which our group had decided or really didn't have a strength in that area or anything that we could do to really help. So a way in which we offered help was to volunteer at their fundraiser in March and continue to make connections with those we knew worked in fund development, agencies, organizations, when we had the opportunity to.
So knowing that there was nothing further we could do to help the women with Buffalo Women and Baby Care Association, we decided to focus on the senior demographic. We identified 3 areas that we could help. The first was the Snow Angels program, because they do have challenges with consistent volunteers, especially in the downtown region. The second was how to improve intergenerational connections. And the third was reaching isolated seniors, especially those who are new to town and the country. We decided on St. Aidan's as a partner agency, as they are the agency that currently caters to the senior population in our municipality. In our proposal to St. Aidan's, we identified our goal, which is to improve intergenerational relationships within the regional municipality of Wood Buffalo. In order to do that, we had 2 objectives. 1, connecting enthusiastic volunteers with seniors, and 2, integrating isolated seniors, especially those new to Canada and or Fort McMurray. We received feedback from St. Aidan's, and some of the feedback that we received were, 1, so connecting the intergenerational aspect felt a bit too broad because our focus was supposed to be on seniors, so we should try to narrow down our objective. The second had to do with, we had 2 big ambitious goals, isolation and connectedness. They advised us to focus on one of those 2 goals. The third was how to, ensuring that we were able to reach volunteers from different cultures by utilizing the MCA and other associations, other country or culture associations that were available in Wood Buffalo. The fourth one was difficulties and the logistics of training seniors with technology, logistic issues of getting iPads, and also how the training was going to work out. The next one was how we were going to create programs for isolated seniors. Another thing was avoiding duplication of services. So the MCA, the Golden Keys, and the Newcomers Association, they all have events or programs that target the seniors population. So they wanted us to just avoid trying to duplicate those and trying to recreate something that maybe strengthen those organizations. And because the CMHA screens the volunteers for the St. Aidan's Association, we would have to use them to screen volunteers if we needed volunteers to help out with seniors. And all in all, I think the feedback that we got from St. Aidan's was that our goal should be something along the lines of to reach new seniors and isolated seniors. So based on this feedback, we revised our proposal, and our new objective was to reach isolated seniors and to help them make meaningful connections in the community. With that, we had 3 focus areas. 1, to integrate isolated seniors. 2, volunteer recruitment. And 3 was appropriately matching volunteers with seniors. We also identified some challenges that we would face along the way. 1 was cultural language barriers, which is why it was important to get volunteers from different cultures. The second is transportation and logistics of getting the seniors to and from events or gatherings. The third was weather issues. So we do live in a very cold climate, and just ensuring that the programs or events that we had were not outdoors that could affect attendance. And of course, number 4 was low participation. Once our proposal was given the go-ahead, we identified our next steps. And the 2 of them, the first one was meeting with the Multicultural Association, especially the Welcome Center, where they do have first contact with newcomers into the city or into the municipality. And the second was FuseSocial, because FuseSocial runs the Wood Buffalo Volunteers, and that would be the link between volunteers and associations. And this is where we would put the volunteer postings for our programs. With that, I'll hand it over to Julie to talk about our activities in January and February.
Thanks, Doyin. I'm going to speak on the activities and tasks that we engaged in for the month of January and March and February. With only 3 months remaining in our project, We wanted to jump right back into things in the new year. It was a bit of a challenge getting started back again, as organizations were just getting back from the holidays and had other additional tasks and activities. But with everyone's flexibility, we were able to overcome this challenge. In January, Joe and myself attended the accessibility and age sensitivity training. This was a very insightful training to be a part of. It highlighted a lot of different challenges that seniors face daily when they age, and it really changes your point of view on what aging actually is. Throughout this training, we participated in a few activities that would demonstrate the effects aging has on everyday tasks. And one of them was to wear fogged up glasses and read out different prescriptions that would include the title of the prescription, the dosage, and then the special instructions. So I think I can speak for Joe and myself and say that it was almost impossible to be able to read the labels on these prescriptions. And it really gave us an insight on how this can have a huge implications for a senior, especially if they don't have someone that can be around to help them with this. I would like to show you guys now a video that Aidan has developed called How Do You See Aging? The video really tore at my heartstrings. Seniors are individuals. They want to be treated like myself and you. Yes, aging can make simple things magnified, but in the end, they just want to be treated as a person and have a lot of wisdom to share with us. So we'll go ahead and play the video now. So if we were to do this as a live presentation, I would ask you guys how this video made you feel, and we would try one of the aging activities that was demonstrated in the training. Since I can't do that with you guys today, I would like to encourage you to go visit or call a senior in your life or your neighborhood and spend some quality time with them and let them know that they are valued and cared for.
Canadian Mental Health Association is another organization that we approached to help us with our project. CMHA has a senior volunteer program that works with St. Aidan's to have a volunteer mentor with the senior to spend time with them together, doing things such as shopping, playing cards, or karaoke. CMHA was happy that we wanted to work with them as this volunteer opportunity already exists, it just needs some traction with obtaining volunteers. CMHA screens the volunteers, and St. Aidan's only requirement is to provide the senior.
Our next task during this time frame was to meet with FuseSocial's Wood Buffalo Volunteers Coordinator. We wanted to meet with them so that the project we are creating can be sustained in the future. We felt that bringing in Wood Buffalo volunteers would be a key partner to ensure this. They were on board and supported our project. We discussed creating profiles on their website for the organization, creating a volunteer job description, and then presenting this volunteer opportunity to different groups within the community, such as the LINK program at Keano and the YMCA Immigration Women Wellness Group. From this point, we would wait to hear on presentation dates and work on additional tasks as needed. The last task during this time frame was to connect with the Multicultural Association of Wood Buffalo. We were unable to set up a meeting in January as they were preparing for their Multicultural Expo, so Joe and Doyin decided to attend the event to engage partners and participants. A lot of conversations were made easily when discussing culture and food at this event. A challenge that participants expressed was language barriers during hospital care. This could be an area we engage to obtain volunteers or an area where we can find isolated seniors. Joe will now speak to our next part of our presentation.
Thank you, Julie. You have already heard that back in December we amended our objective to one goal, which was to reach isolated seniors and help them make meaningful connections in the community. Our plan was to collaborate with St. Aidan's, the Multicultural Association, the Canadian Mental Health Association and Wood Buffalo volunteers to identify isolated seniors and people who would be willing to volunteer with them. In early March, Nicole and I met with the Welcome Centre to discuss whether they could help us. The conversation was really helpful and we were signposted to other local agencies who might also be able to help us. We were hoping to set up a meeting with the Multicultural Association, but they were operating at reduced capacity and not accepting new partnerships. Julie made arrangements for some of the group to accompany Shelby from Wood Buffalo Volunteers to a language instruction for newcomers to Canada class with the aim of recruiting volunteers. However, shortly before we were due to attend that class, we received an email from Shelby informing us that St. Aidan's did not want to be receiving volunteers at the present time due to limited staff. This took the group by surprise. We discussed the news as a group and realised that there had been a misunderstanding between everyone involved. We had made a mistake when we spoke individually with Wood Buffalo volunteers, the Canadian Mental Health Association and St. Aidan's. However, we had not coordinated a group meeting to speak with all of them at the same time. We decided to hold another meeting with St. Aidan's where we clarified that our plan was to bring in Wood Buffalo volunteers to assist with recruiting volunteers who we would then refer on to the Canadian Mental Health Association. They would then work with St. Aidan's. St. Aidan's had been under the impression that we were sending the volunteers directly to them. Our discussion was really positive and re-energised the group. It was reassuring to hear that we still had the right idea. We gained clarity on the qualities and commitment required from any potential volunteers, and we also gained a better understanding of the limitations facing St. Aidan's in terms of staffing and capacity. We asked exactly how we could help in the present moment, and the reply was that they needed help with locating more of the isolated seniors in the community that they knew were out there. Colleen will now take us through what happened next.
Thanks, Joe. At this point, after meeting with Luana again at St. Aidan's, we would now strictly focus on identifying the isolated seniors. Then COVID hit, and it was so important at St. Aidan's that the vulnerable seniors were still supported and stayed safely in their homes. Then what happened next? The flood hit, and through the census it was known that a massive 32% would be affected by this, and through these emergencies it is even more important and imperative that we know who these seniors are and where they are. The pandemic and the flood have done more than we could ever do, or what St. Aidan's could do, in terms of educating the community and realizing the registry of so many of these seniors. Now let's circle back to what Doyin had mentioned earlier as part of our original idea of teaching technology to seniors, having them much more connected so when everything was shut down and help was needed, they could still see and use the resources available to them for any help they might need, deliveries of groceries, meds, contacting doctors, etc. The gap that we had identified there still rings true. So now that many more seniors have been identified, it is time to get them connected and taught. Incidentally, through these emergencies, the United Way has made funds available to St. Aidan's to purchase iPads and tablets. Holy Trinity High School has partnered up to teach seniors, and now the public school is excited to join this initiative as well. For us, we will keep the momentum going on the messaging that seniors are valuable and need to be connected socially and technologically.
Thanks, Colleen. I would like to conclude by discussing some of the positives and negatives we faced as a group. Despite being a diverse group with different backgrounds, strengths and ideas, we collaborated well. Our meetings were always respectful and everyone's ideas were welcomed and considered. There was no conflict. Because of our differing careers and family priorities, scheduling meetings was sometimes a challenge, but we were understanding of each group member's personal commitments away from the group. We had success using WhatsApp as a line of communication that was always open, and when we were able to get together, we made efficient use of our time. Our strengths, as identified at the beginning of the presentation, played a large part in keeping our momentum going through periods when it seemed that nothing was happening or things were not going to plan. We did, however, face some challenges. Our communication with the agencies we were working with was not as clear as it could have been, and you have heard how this caused a problem. However, we were receptive to the feedback we received, we regrouped and moved on. Collaborating with multiple agencies also caused issues with scheduling meetings. We learned to be patient. The organisations were busy with annual projects of their own that took up a lot of their time and energy, and we had to wait. We understood that we were not a priority. Along the way, we were able to recognise and utilise the different leadership skills we had learned throughout the Leadership with Buffalo programme. We would like to finish by taking the opportunity to recognise and thank the agencies that we have worked with: St. Aidan's, Wood Buffalo Volunteers, the Canadian Mental Health Association and the Welcome Centre. And finally, we thank you for your time.